Hello, I'm Chris Merriweather. I'm a sales representative for the compound, for the pain compound that we make. And I'm here with Dr. John Adams, board certified pain specialist. And basically the first time I came in and I introduced this pain compound to you, I mean, what were your thoughts when I told you that here's a compound that works in minutes, it lasts for hours, and the side effects are invisible?
I was optimistic but skeptical. I've seen similar claims from similar compound companies previously with questionable results. I was willing to give it a try, but I really wasn't expecting too much from it.
Okay. After you experienced use with the patients, I mean, what were your thoughts at that point when you actually, probably for the first time in the career, where you actually saw a product that did exactly what the sales representative said it would do in the beginning?
Well, the way that I initially used the product, the samples that were given, was I had a patient that came in and we were trying to come up with options. They had tried several medications. They really did not want to utilize the stronger medications such as opiates. And I gave them the option of trying some samples like I do with several medications, especially the newer ones that come out. And since I'd seen similar products in the past that had not worked that well or had worked marginally at best, I didn't want to put my reputation behind it. I told them, try this. I'm not making any promises. Let me know how it goes. We can get a prescription for it if you like it. That's about all the support I put behind it. Well, they came back. They said they did want more of it. It worked well. So that was a glimmer of hope to increase the optimism. I did the same thing for a few more patients, and I started seeing very good results coming back. And over time, this formulation, which I also like because I could actually change the concentrations or change the components of as needed for an individual patient. This formulation and this type of product became, rather than an ancillary or occasional use medication, it became one of the major tools in my portfolio of tools to use to fight pain with patients. It became one of my go-to medications, as it were.
Very good. Now, what do you do when, if you were speaking to a colleague, another physician, pain specialist such as yourself, what would be the verbiage you would use to get a referral to actually prescribe this product, or to take a good hard look at it to see that it would work parallel in his patient population?
Well, as a physician, what we often look for in a medication are a few things. Number one is efficacy. We want something that works. This medication formulation has in it medications that we know work. We have medications to address inflammatory mechanisms. We have medications to address neuropathic pain. We have medications to address muscle spasm, and we have medications to decrease the peripheral input of pain signals, thereby affecting neuropathic pain. We can also add in some additional components to address other angles to hit the pain from several different mechanisms. So as far as efficacy, that's what I'm looking at there. I would also use my personal experience and the experience that I've seen with patients to help support this position. I've seen athletes that have had years of chronic pain, that have been on multiple medications. I've seen their pain dramatically reduced. I've seen soldiers that were unable to be on the stronger medications, facing an end to their career, that this medication has enabled them not only to go back and start physical training, but actually re-enter a theater of combat that they wanted to go to, but would not have been able to with the other options. I've seen people who were on high doses of opioid medications that were able to come down to lower doses, and in some cases even get off the opiates entirely because of the benefits that this medication was able to give. I've seen I've seen patients who were able to get down to lower doses of opiates, but then when asked, well, you still need the opiates? Well, do we really need this pain medication? They were adamant that yes, this does help. That says volumes in itself. So number one, efficacy. Number two is safety. I want something that is safe for my patients. Again, the medications that are in this product are medications I frequently use in the oral form. That form puts the medication systemically at much higher volumes, much higher concentrations throughout the body. It also can, for some of the muscle relaxants and the neuropathic pain medications, it can push the doses systemically high enough to cause some decreased cognitive function. With the topical or transdermal technology, the concentrations are very low, on the order of 5% or less than what you would get with an oral formulation. So the cognitive side effects are minuscule, if any at all. The GI effects, compared with oral medications, we completely bypass the liver and first pass metabolism, thereby easing off the strain on the liver. Since the concentrations are lower, there's less for the kidneys to metabolize. Since the concentrations are lower, it's going to have a lower effect on the gastric lining, that you would get a more pronounced effect with the nonsteroidal anti-inflammatories. As far as the safety, really the only side effects I've seen are some mild skin irritations, which if that's the case, the patient can simply discontinue the medication, or we can try to work with the components within the medication, pulling one component out at a time to see if we can identify which one is the offending component if they have no other history of allergies. The other is ease of use. This is a very easy to use medication. It doesn't give a bad taste as oral medications do. It doesn't give the GI side effects that many oral medications do. It's simply applied to the site of pain, and that's it. The packaging that RxPro uses is extremely easy. It's not an unpleasant smell to it. It's not a greasy sensation. It's not painful to apply. It's very comfortable, very easy, and very easy to transport or keep in their desk or keep at hand. All of those issues are things that have been very helpful. Those are the biggest components that I would see, and I would encourage my colleagues to give it a try. Patients that usually by using it with 5 or 10 patients, you'll get a good feel of how well this works. One thing as physicians we often forget is the concept of number needed to treat. We know that with any medication, you never have a 100% success rate. If you treat 10 people, a percentage of those will gain benefit. In pain medicine, be it through medication, surgery, or interventional pain management injections, we're looking for success being defined as improving the pain by 50% or greater. That may not sound like much, but if you can take someone who's in severe, debilitating pain and reduce their pain by 50%, then you've given their life back, you've given their function back, and that's really what we're aiming for in treating chronic pain. It's not to say that they will never need anything else, that they will never need physical therapy. It's not even saying that they won't necessarily need surgery at some time. If they need surgery, of course, this is not going to be a substitute, but we try to minimize the number of patients that have to go down that route.
Okay, we talked about safety, we talked about efficacy. What have you seen as far as onset of action? How long does it take for the product to actually start to work with the patient, start to see relief?
Well, the onset of action is very fast. The onset of action could be, as I've seen, as little as 30 seconds up to about 15 to 20 minutes. Now, that's not necessarily the peak of action, but the peak of action, I would say, would be around the 4-hour mark. But patients notice a significant improvement within as little as 5 to 10 minutes generally. Some of the medications, such as the neuropathic pain medications, have a build-up effect. So you'll see continued improvement over the course of 2 or 3 weeks. That's why it's very important when using this sort of product that the patient not expect one application and they're good for days. It's important to stress that they need to use this 3 to 4 times a day on the site that they're having the pain, and use that for a period of about 2 weeks and then reassess the results. But really, I've seen substantial benefits within anywhere between a few minutes to a few hours, and that's very encouraging. The important key is the follow-through, that if they get a good result, then they continue using it and then reevaluate. Now, over the course of time, what I have seen is that once the pain is brought under control, I can reduce some of the other medications that they're on orally, and I actually sometimes see them scaling back to the point they only need the medication 1 to 2 times a day. Why that phenomenon occurs, I'm not really sure. I'm thinking that it's likely we've reset the pain fibers, we've decreased the inflammation on a more of a chronic basis, and we've gotten them down to more of a maintenance therapy as opposed to the initial interventions that we're using.
We've established those points, and the main point as far as what you see in your overall volume in your practice is the success rate of actually using the product. Of all the patients that have used it, what would you say your success rate as far as percentages? Would you say it's a 70% success rate, 85%? So what have you just,
well,
what have you seen?
It certainly varies. Different people describe success differently. For one patient, anything short of 100% success or 100% relief is not success. I would love to say, as any physician treating any disease, including diabetes, hypertension, chronic pain, any physician would love to say they had a 100% success rate. If they say that, they're probably not being honest. I don't have a 100% success rate, but an estimation would be in the 70 to 75% range of patients that are satisfied and happy with the results that they're getting. That indicates that they are able to get a result that gives them a greater degree of pain relief and function with an acceptable level of side effects, which, as I said, with this medication is very low, that they're happy with. That's a success rate, and I would place that at the 70 to 75%. And that's something that, when asked the patients, is this helping you? Do you want to continue it? They say, yes, I do.
So how does that compare with other pain medications and treatments or therapies that are out there? A 77% success rate with the compound versus the other medications. How does it rate?
Well, compared with opiates, for instance, what I noticed with opiates is that with opiates you get what I call the honeymoon effect, meaning you get very good results with pain relief from the beginning, but over time that decreases, and you have to turn up the dose and turn up the dose further and further. And if you're not careful, what you will get is a very high dose of opiates with a very low dose of pain relief, or a low effect of pain relief. Some have given a theory of centralized hyperalgesia, where you're actually sensitizing the nerve endings with the opiate medications. Others have given other reasons, as simple tolerance building up. Whatever the reason, you end up going higher and higher in the dosing with lower and lower effect. What I see with this medication generally is the exact opposite. You start out with a dose of 3 to 4 times a day, And over time, you're getting benefit. The patient appreciates the benefit that is obtained, but they find they have to use it a little bit less, or maybe even as little as once a day to help them get the pain relief that's needed. Also, I'm noticing that I'm able to turn down some of the other medications. It's using something to control the pain at the source without undue side effects has enabled me to be able to slowly titrate them off the higher doses of opiates, decrease or eliminate the oral nonsteroidals, decrease some of the oral muscle relaxants or neuropathic pain medications that can cause confusion, sometimes even putting them at an increased risk of falls and other situations. So this product has several advantages from both the patient standpoint and the physician standpoint.
Okay, very good. Well, that concludes our presentation. Dr. John Adams, I'm Chris Merriweather. Thank you.
One moment. Let me put one more thing.
Okay.
One other thing that's important from a physician standpoint is the ease of prescribing from the physician's perspective, and that's where RxPro Pharmacy really shines. There's a web-based physician portal that the physician can sign into, put the patient's prescription in, and send it directly to the pharmacy, which eliminates the likelihood that the prescription will not be filled. Physicians don't realize it, but up to 30 to 35% of prescriptions they write are never even filled for whatever reason. This greatly reduces that number. The other thing is excellent sales rep backup and patient servicing. The other thing is the ease of the patient getting the prescription. In most cases, the prescription can be mailed directly to the patient, as well as the refills. And the convenience for the patient that they don't even have to go across town to the pharmacy. That's a huge factor, especially if it's an elderly person or a person with limited transportation capabilities. The application of the compounds is also a strong point in that it's very easy. It's easy to transport, it's easy to store, and it's easy to apply. All of these factors improve the efficiency, the efficacy, and the convenience for both the patient and the physician.